Gout is a painful condition that affects your joints. It happens when you have too much uric acid in your blood. Uric acid is a natural waste product, but high levels can form crystals. These sharp crystals can build up in your joints, causing intense pain and inflammation. Gout often affects the big toe, but it can occur in other joints like your ankles, knees, wrists and fingers. Imagine sharp needles poking and burning inside your joints. That's the kind of pain gout can bring. Gout attacks can be sudden and severe, often waking you up at night. The affected joint becomes hot, red and swollen, making it difficult to even bear the slightest touch. While gout is a treatable form of arthritis, it's important to manage it properly to prevent future attacks and potential complications. There are different ways gout can present itself. Understanding these types can help you and your doctor tailor the right treatment plan. Acute gout. This is the most common type, marked by sudden and severe attacks of pain and inflammation. These attacks can last for a few days or even weeks. Chronic gout. If left untreated or not managed well, gout can become chronic. This means you experience frequent and recurring attacks leading to joint damage over time. Interval gout. This refers to the periods between acute gout attacks where you might not have any symptoms. Advanced gout. In some cases, untreated gout can lead to the formation of hard lumps called tophi. These tophi develop under the skin, usually around affected joints. Gout is primarily caused by a buildup of uric acid in the blood, a condition known as hyperuricemia. Our bodies produce uric acid when breaking down purines, which are naturally found in our cells and in some foods. Normally, our kidneys filter out uric acid through our urine. However, sometimes our bodies either produce too much uric acid or our kidneys don't eliminate it efficiently. This excess uric acid can form needle-like crystals in our joints, triggering the painful inflammation and symptoms of gout. Section 4. Risk factors. While anyone can develop gout, certain factors can increase your risk. Diet. Consuming a diet high in purine-rich foods like red meat, organ meats, seafood and sugary drinks can significantly increase uric acid levels. Alcohol, especially beer, interferes with the body's ability to eliminate uric acid. Obesity. Being overweight or obese puts extra stress on your joints and increases uric acid production. Genetics. You're more likely to develop gout if you have a family history of the condition, medical conditions. Certain health issues like kidney disease, diabetes and high blood pressure can increase your risk. Medications. Some medications, such as diuretics, can also contribute to gout. Section 5. Gout diagnosis. Diagnosing gout typically involves a combination of physical examination. Your doctor will examine the affected joint for signs of inflammation, redness, swelling, and tenderness. Medical history. They'll ask about your symptoms, medical history, family history of gout, and diet. Blood test. A blood test can measure the levels of uric acid in your blood. Joint fluid test. In some cases, your doctor might extract a small sample of fluid from the affected joint to look for uric acid crystals under a microscope. Section 6. Prevention and precautions. While you can't completely eliminate the risk of gout, you can significantly reduce your chances of developing it or experiencing future attacks by dietary changes. Limit your intake of purine-rich foods, sugary drinks, and alcohol. Focus on a balanced diet rich in fruits, vegetables, whole grains, and low-fat dairy. Hydration. Drink plenty of water throughout the day to help flush out uric acid from your system. Weight management. Maintaining a healthy weight through regular exercise and a balanced diet can reduce stress on your joints and lower uric acid levels. Medication. In some cases, your doctor might prescribe medications to lower uric acid levels or manage inflammation. Early diagnosis and treatment. If you experience sudden joint pain, especially in your big toe, seek medical attention promptly. Early diagnosis and treatment can help prevent complications. By understanding gout, managing your risk factors, and adopting a healthy lifestyle, you can take control of your joint health and enjoy a more active and pain-free life.